Welcome to La Casa de Spa. I'm happy that all of you are here with us tonight. And we're here to hear Ilora. Originally I thought that her talk was going to be about the fact that she herself is a holistic MD physician and that she was diagnosed recently with cancer, and she had a theory about why she developed cancer, and I thought she was going to share that with us. And she probably will go into that a little bit, but something more recently has happened that would be of great interest to us tonight, and that is her visiting the hospital. And I think earlier today she said if she had not been an MD, she would not have come out of the hospital alive. So I'm very interested to hear her story. Ilora, welcome to La Casa de Spa. This is our Tuesday night series, and I'm very happy to have you and to hear all about you, your journey, as your journey is wherever it's taken you.
Thank you so much, Jane. And I just want to thank everyone who really obviously have come here and embraced me with their energy. I can really feel it's tremendous. It's really comforting to me coming out of a healing experience to be surrounded by such warm energy tonight. I appreciate that. My journey is a personal one, a unique one from many perspectives. Somewhat that has started, I think, about 30 years ago, because my mother was diagnosed with breast cancer at age 32, and I was 12. And that was about...
Excuse me for 1 minute, James. Is music on?
Yeah, is it coming from here? Claire, is there music on?
I need some background music sometimes, in case I break out into it.
We'll make the music with you.
It's a wonderful thing to be able to share my healing journey with you all. Part of my journey with this experience with cancer and has been very unique from the perspective of being a co-survivor and someone who's shared that journey intimately with my mother. I was about 12 years old, so you do the math, 30 years ago, and my mother was diagnosed with breast cancer at age 32, which was quite profound at a time where everyone wasn't walking around with a pink ribbon, and there wasn't a lot of support. She was a new immigrant mom. She was actually prenatal, during her prenatal care was observed. And I was really affected by this experience, but more by her example as a survivor, and how she always had emotional resilience. There was tremendous strength and optimism throughout the course of her survivorship. To that, I'm extremely grateful, because I think it was the first education I received as a physician, is to be a co-survivor and to be someone who's there in the process of healing. Not a lot of people really get to benefit from that. And some of that has taken me over the course of many recurrences. In her 23 years of being a survivor, she had many recurrences and relapses. And, in that process, I had decided to take this path as a healer, and today I can tell you I'm a healer. Years ago, I chose to be a physician. I chose to devote my life to help others, as I saw that was something uniquely that my mother benefited from as a young child. And it's been a tremendous privilege. I think many of us will debate, and now being a patient, I have new perspective on what it is to be in a doctor-patient relationship. I have great respect for it, but as many of us are here, we know that the landscape of what we call healthcare has changed tremendously. And, as many things, 30 years ago there was no GPS, and as we know today, whenever that journey changes, we get to recalculate. And I have had many phases in this path that I kind of have really been supported by faith, by extreme respect and gratitude for the experience of a patient. And to that, it has really served me well in my relationship with others, above all, than to be a physician and a healer and someone who's there to witness someone's pain, to hear their story, to understand their grief, to share in their blessings when there are good things to share with patients. Sometimes we forget that. And tonight is a good day for me, and I'm here to share with you all. the journey has been a difficult one, you know, and I have seen my mother through many, 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 many trials and tribulations. And sometimes, you know, as optimistic as the journey can be for a survivor, because I think initially we all choose, are we going to be a survivor? Are we going to be a victim? Are we just going to give up? You know, there are many parts that you can take. There are many roads that, you know, are on the path. And sometimes we do need a moment or two where we just say, I'm going to step this one out and I'm going to pause. And for the last 4 weeks, I've been on pause. I really have let the experience of being a patient now take me down the road that I hadn't traveled before. Although it seems so intimately my own, I found that, you know, the resilience helped me tremendously because, you know, as someone who had been hypervigilant about screening and mammograms and, you know, I knew prevention guidelines back and forth every time it changed, the controversies. I was really such an advocate. You know, I became, you know, it became my life's mission, and advocacy around breast cancer was something intuitively I felt that I was really meant to serve. And, you know, it became very frustrating in January when I, you know, dealt with it myself, because I felt all along prevention and the guidelines and following a lot of the you know, the guidelines and the preventive, you know, even though there are so many thought processes about this, we still haven't figured it out. And it is frustrating because it doesn't necessarily change. I felt 30 years later, the story's the same. My decisions are the same. The choices are the same. And in fact, they're more radical. And, you know, sometimes it really allows you to briefly pause and decide, how are you going to heal? Where's the course of healing going to begin? And one thing I do value is, in the perspective of my mother's health, first and foremost, being a woman who did not have the support circles or the groups, and knowledge is power. So I remember intimately going to libraries and the public library system and getting to that aisle with Dr. Susan Love's breast book, you know, the Bible. At that time, there weren't too many other profound writers of breast cancer advocacy, and she read and she read and she read, and, you know, I think trying to absorb as much and trying to get all the information and trying to deal with it was very limited at the time because we didn't have the internet. And I know now it's definitely very, very confusing. You know, one day the messages, public health messages say mammography, you know, early detection is the cure. You know, and a few months ago, and in my own experience, early detection, you know, is the cure, but in some ways, wow, I've been, you know, doing early screening since I could remember. Because at 32, if I asked surgeons when I was in medical school, when should I start screening? You know, if you say 10 years before your primary relative, well, my mother was 32, do I start at 22? No one could ever ask my questions. Oh, my ducts are large, do you think I should do something? Oh no, you have healthy breasts, you know, and it was very frustrating, and I think the system isn't very clear on what the real issues are, and there are a lot of issues. And nowadays, 30 years later, it's definitely more of the xenohormones, the endocrine disruptors, the antibiotics in the feeds, and how our environment is really creating a perfect storm for cancer at all types, and breast particularly, as well as prostate for men. I think they're pretty much the equivalent if you think about it in both genders, and they're both very sensitive to hormones. So I was very frustrated, but felt very equipped. I think when I had heard that breast cancer was my diagnosis, I didn't have a moment to pause. I really felt I had a call to action. For me, I believe cancer became an opportunity for me to heal myself. It was a call to action. It was, as actually, a colleague of mine, Stephen, had mentioned to me, well, the cells are out of control. That's all it is, you have to love them. They're your cells. There must be a reason this is happening. Find balance. Maybe it is about finding balance. It's about finding balance in your relationships. And there's sometimes a deeper emotional release that you need to experience. And I know I have had such a strong connection with Mother and such a strong co-survivorship over 23 years. I felt so intermingled with that spirit of being a survivor. When it came upon me, I said, these are the shoes that were meant to be mine. I have to wear them and I have to walk this path. And, instinctively, I, really just went into action. Part of it may be having the background of being a physician, and I may be in a logical and a very rational frame of mind said, okay, I have a biopsy to do, and I have to get this imaging done, and, I knew the steps, but it was definitely difficult to be the patient. The steps were there, and the decisions were hard too, I had been told I had a very subtle change on my mammograms, and I had been very rigorous on follow-up, and being only 42, if the screening parameters tell you to start at 40, I've been screening since I was in my mid-20s, late 20, and many of my images looked very similar even 2 years ago, but it was really quite subtle, and I think part of the experience of this is very eye-opening that, many of the changes, mammography isn't really great, it's not really a technique alone to understand, but there's a deeper understanding, and I said, perhaps I'm learning from this, and there's a purpose to me being a survivor now. There's a purpose for me to heal. Maybe there are others that can benefit from this journey, and maybe it's time for me to share my story. I have not shared it. There have been many people that understand the experience I've had, the kind of relationships that have developed from me taking care of my patients. It has been a way of kind of coping with the loss of my mother. My mother passed away in 2006. Prior to having very successful relapses, her very immediate relapse was to an ovary. In fact, they had said it was still breast cancer. It had spread to ovary. It was not a new cancer. And it was really shocking because we really didn't think that after that many years that it would still be back. So I took care of her, there was a lot of palliative care that I was involved with, and that caregiving in itself, I know is such a tremendous stress to the body, and sometimes often overlooked is how that co-survivor recovers, and about 8 years later, I feel maybe some of that is something that did have a very, there's this emotional body that we have. And, part of that, embracing the holistic in my life has been the real understanding of that spiritual, emotional, physical body and the connections between the two. And when I realized I had these, these ripples in my emotional fabric that really, it was time to really look deeper, and really this opportunity was really an opportunity to heal and be loved and to benefit from also the one thing which I had never seen my mother be was vulnerable. Boy, when you have the diagnosis of a cancer or any kind of illness, I mean, it doesn't have to be cancer, I think any illness makes you very vulnerable. You feel a complete lack of control, of autonomy over what we assume will be ready when we wake up in the morning, and are able to kind of draw upon the health that we all would like to believe is there for us when we need it. It is definitely very disempowering to your spirit, if you allow it. And in the moment of feeling like, maybe this being a co-survivor and always being strong for so long this was my time to be vulnerable and to embrace that too, to allow other people to put on your shoes for you or help you out of bed, to be in the hospital and, be vulnerable and, to learn to embrace that ability to heal from your deeper core and to release all the negativity that you still carry in your emotional fabric. I was lucky and blessed all along the journey because as I made decisions, I have a great belief in spirit and faith that things are blessed. And anytime there's a decision that's made, things are blessed on the path, and you can tell. And the minute my mother had left and transitioned in 2006, I started recalculating my career. And in 2006, I had decided I can't run this hamster wheel anymore in the hospital. I practiced internal medicine at Montefiore Medical Center, and it is a very large hospital-based practice. And, it was a lot of energy, but I felt that all I was doing was moving patients in and out of the hospital. And I wasn't given the opportunity to have those conversations about prevention and health and wellness that I knew was really something we were missing in healthcare. That just to keep sending patients back and forth to doctors and not see any changes was, to me, the biggest break in my own integrity. And when I, came to accept that was no longer a place where I could function as, let's say, a healthcare provider. I didn't want to be a provider anymore, as insurance companies would deem me. I don't want to be a provider. I want to be a healer. So if I choose to be a healer, I need to be in a different place. I need to create the environment that supports it, and I have to embrace it in a way that can actually be a real energy-driven center that naturally draw in the right kind of integrative therapists. I learned a lot about that in my process, and little by little, it came to be that law of attraction, where you draw in what you believe in, things would appear. So the perfect office appeared for me. All the right things came in line, and I said, either my mother wants me to go in this direction, and this is something that's blessed. Maybe this is the path. And prior to this, it would always be very logical, and you're a physician. You're made to absorb details and facts, and you'd always use your brain, not your heart. I was never heart-centered. You had to change that, because if you're going to work with patients from a holistic perspective, this has to be your center. And at the same core, part of my mission was to really give back to patients who are survivors and still connect. Because in my mind, when death becomes a void, when many of us have, as physicians, have dealt with loss, grief, and healing of patients in the hospital, sometimes more intimately than their families. I've witnessed many deaths, and death experiences, some very tragic and some very, very beautiful in a hospital. But what was very personal to me was this loss of mother, which was really quite profound. And this depth of emptiness that it creates, this vacuum, it can either create, as I know, many, many, consequences of like this quicksand of depression. And, it's very hard, people, to deal with that emptiness. But I felt in some ways that as I felt my mother's energy transition from a physical place to a spiritual place, and I really did feel that, in that her hand was guiding me even after she had gone, that just as such, my love for my mother cannot end. If she's still present in a spiritual place, then that emptiness, I need to create a new way of changing that love for mother into a love for purpose. And the purpose was really to be more holistic and create this environment where patients like her, or who deserve that kind of environment, would be able to be healed in that real, proper way. And, initially having a psychologist and acupuncturist and all the Reiki practitioners, and I learned Reiki myself, and actually been blessed to really practice that, and sometimes even doing outreaches to different centers, including Ralph Lauren's Cancer Center, and finding integrative nutritionists and nutritionists who would collaborate with me on some of the unique understandings of just nutrition and food as information, right? That maybe unlocking the keys to prevention are things that we really have taken for granted, and that the epigenetics of cancer, it's right in our hands, you know? We really do have a missing link, and that the message is wrong. The message is not about tradition only in the sense of technology. We really have such old technology that already works, and we just have to really find that medium. So it was a negotiation, you know, because a lot of my patients came directly from the hospital, and this experience of creating a different way of practicing was very new to them. They didn't know if I was a practicing Buddhist, or why I had the Tibetan flags in my office, why did I burn incense. Things became clear to them as they understood my experience, and I found myself also in that space less inhibited by the knocking on my door. Oh, you have another patient. You're taking too long. You need to speed it up. You have 30 more waiting out there, or the cattle calls of patients that would be. First 5 minutes of any visit at my hospital was, how do I just calm them down, because they've been waiting for hours, and I said, this is just, how can I micro practice? How can I create like the small size instead of super size? And I think we're, as a society, trying to get back to the intimate, get back to the authentic, get back to the reality of just life experiences, sharing and connecting. I found myself very free with the patients and really being able to explore things much better. It was very healing just to be in a different space. And even now, as I'm journeying back to coming back to the office, today was, the first day I actually ventured back into my office after 4 weeks. I'm going through recovery right now. I was operated on March 5th. I had made big decisions after my mammography, which was very subtle, very early. They said stage 1. However, I'm 42. My mother was 32. She had very early stage 2 cancer, but she survived many years. And I was really dealt this big decision. Do I ask, my mind, am I going to act in fear? Is this fear? Is this reality? What should I do? There's a lot that I need to kind of absorb, and I try to really get as many opinions as possible. And being someone who chose this alternative or holistic route in practice, I found that I was at tremendous pressure to, find the exact answer right away. And I chose to speak to an integrative oncologist before I even went to my surgeons. My surgeons were quite open, for me to debate and think about my decision first and foremost. And I really decided with a heavy heart, because of the 23 years of seeing my mother struggle with cancer, and having a lot of relapses. It was a very personal one, and every year I attend Susan G. Komen's annual luncheon. I'm someone who's contributed in many ways, and many of the practices where I've served before as an attending or a medical director, we were very, very eager to have screening grants sponsored by Susan G. Komen. And I know the year before I was quite cynical about the fact that Angelina Jolie had thrown out this editorial sharing a very personal, intimate story about why she was BRCA positive, and she had decided to have prophylactic bilateral mastectomy. And I believe very soon she's either in the process of removing her ovaries, but she had made this a very big, open discussion. And I was quite emphatic that that's such a personal thing. And to put it out there as such a high-profile actress, it gets confusing for patients, because 5% of all cancers are genetic, 95% are not. we all have BRCA. Not all of us express the suppression of the inhibitory effects. My BRCA test actually was negative, but I actually had many conversations with surgeons and other doctors to say, well, how many people of my ethnicity have you studied? How do you know there's not another gene? Maybe I have an error in detoxification. That's not part of your workup, right? So how do I know that I can't detoxify estrogens? Maybe that's something my mother shared. So there are questions I had, and here I was a year later having to make a very similar decision. After the mammogram showed this very subtle lesion, the MRI at Mount Sinai showed very extensive non-mass enhancing ducts. So if it was like snow on the ground, and I know we had so many snowstorms during that effect, it was like the branches of a tree lit up with white. That was how my ducts looked. And I was shocked because I had to go and do 2 more biopsies at Mount Sinai because the MRI showed just so much more extensive precancerous ductal carcinoma in situ. And at that juncture, I really didn't have the comfort to not be more aggressive with my care. And as much as I felt a little bit, fear, in that fear factor, do you make decisions out of fear of love or love, right? I mean, we often want to choose wisely and choose with love in our heart and not feel fearful, but I knew the experience of my mother, and my children, surprisingly, are almost the same age I was when my mother was diagnosed. I have 2 boys, and they're 10 and 11. And I said, boy, I do not want them to experience the kind of co-survivorship and that guilt. I would like to live my life free of this worry and this concern. So I decided to have bilateral mastectomy, and it's been about 4 weeks right now. It was a real radical surgery. I was operated on from 9 a.m. in the morning. We had to book a whole day in the OR, and I have to say I had not a lot of fear going into surgery. There was a comfort about the decision I made, but there were choices I was going to make thereafter. So I feel that above all, I know patients, I've always been very much a guide when it came to my relationships with patients and how they choose their plan, that I'm not there to dictate how they should heal or what their journey should be after they've accepted. First of all, I accepted that diagnosis. I was more worried, believe it or not, the minute I found out, I was more worried about how would my family take this, because God knows my family and all of my mother's family, we're still trying to embrace the fact that 8 years later she's gone, and this was like opening up this old story about cancer in our family. And it was difficult because the same conversations come up. And what I realized in the matter of things is you do see that your illness is a mirror, and so are your relationships. And I was mirroring my mother in many ways. And somehow the role I took on in the family was as if I was still her. And I had to let go of that, because there's something about this karmic cycle. And whatever relationship we had that was so strong, yes, I did take on a lot of that role in the family. And I think you have to see a deeper part of finding the right doctor or finding the right healing environment, choosing the right supplements, getting a plan of your diet, or deciding to do a genetic test to look at your SNPs, right? To see where your genome may have errors of inborn metabolism, detoxification, figuring out a routine for exercise, for mind, body, for spiritual practice. All of that is wonderful, but deeper than that is, how do we let go of the emotional elements in our relationships that we're still holding on to? How do we release toxic emotions? because that really does have an impact on the vibration of our spirit and our ability to heal. And I said, wow, I thought I dealt with this, and this was a reawakening of old things. There can be very, I've seen this in regards to how many patients have told me that cancer was the best thing. I mean, how many people have heard that? I know it sounds great, when someone says cancer was the best thing that ever happened to me. It's not all that cracked up to be, right? I could choose some better things that could happen to me. What do you think? However, it does heal a lot of old things. It's very interesting. I was, I had a very close bond with my mother, and in the process of her death, my father and I were not as close. And I have to say, that's been something that's been healing very well. Now that, he's seen that it was a very much an opportunity for us to get closer. For him to understand that there's a lot of the guilt that he carried that he needs to let go of too. So we were able to share a little bit more. My brother and I, who were also facing the same kind of co-survivorship. I mean, my brother is also 12 years younger than me, so the story is, he is obviously the child that my mother was carrying when she was diagnosed. He's also a cancer by horoscope, right? So it's very interesting. But he sees me as a mother figure. So again, I stepped into a role that became similarly to my mother, the role that I chose. So I'm learning now to be a sister to him and not a mother. Because I said, maybe I have to let go of that relationship. It's not meant for me. I'm meant to have and embrace a different relationship. And I'm choosing to do that in a lot of the past relationships, because I think what happens is we don't deal with the past relationships, and we do carry remnants of it. And emotionally and vibrationally, that does affect our core. A lot of my experience in the hospital was not always so pleasant. Being a doctor and having many experiences, at least with childbirth, at least that's the few that I've had, never always went so smooth either. So I, chose a magnet hospital, a premier hospital in the city. I guess I can say that it was Mount Sinai. Actually, my brother-in-law is also an employee there, and he manages radiology. And first and foremost, it was really the comfort of having someone, from your family be there. And when I needed that breast MRI scheduled the next day after I found out that I was diagnosed 6:30 at night, I called my brother-in-law. I did not call my husband to tell him or share him with the news. In fact, I don't know how I spent that evening not being able to share, but I wasn't ready to absorb that yet. But I did call my brother-in-law, and I asked him to put me on the schedule. I said, I need a breast MRI tomorrow. Can you put me in? And he did. I immediately called a colleague who was a breast surgeon, and being someone who refers a lot of patients to doctors, there was someone I really loved and I trusted and admired as a colleague, and she was really great, because I said to her, I'm going for an MRI this morning. Can I see you today? And I said to her, though, I must go back and see patients. So I went to my office, saw patients, and then she said, please come to my office. I'll be done with patients myself, and we'll spend some time. We'll talk about your results. So I was really blessed. I really think, above all, it's really who's part of that journey. So my doctor, Dr. Newell, was excellent, and she shared with me the results. She explained everything, because I needed to be a patient then at that point. And I was ready to let her be the physician. So she spoke to me for 2 hours. She drew my blood to do the BRCA test. She discussed with me the MRI results and how beyond the small area that we had seen, there was all of this. If it's 3 o'clock, it was all the way by 1 o'clock. That wedge of tissue looked like there was more, and it was in my ducts, and none of it showed up on my mammogram. Sometimes they'll say, oh, there's calcifications. There were no calcifications. I'm 42, I'm pretty dense. Maybe a mammogram is an option, optimal. So you know, I was really pretty lucky because immediately after I decided, okay, I will find out what else is going on. So I got another MRI-guided duct and biopsy done at Sinai. You know, two more biopsies. I was a pincushion by the end of the week and wasn't sure, you know, who to talk to. I really couldn't find the words. It was very hard because you knew this was happening. It was unraveling, and you just had more steps to do and more appointments, and it just becomes overwhelming. And as much as also I had to kind of leave that behind, walk in the room and listen to someone else's complaints. Sometimes trivial, but you know, then you say, wow, these patients complain a lot. I just had 2 biopsies. I'm not feeling too good either. And I don't need a sick note. I'm here seeing patients, right? It's hard. You find that you're not as patient with things, and sometimes in the midst of absorbing all of this, I was going through emotions, you know, trying to deal with what was happening, what was before me, and you know, making those big decisions about, you know, do I go further with this than I expected? Unfortunately, the biopsies did show there was a lot of precancerous ductal carcinoma, and it was in a large section of my breast, and it was all in the ducts. And 2 years ago, I had ductal symptoms, and nothing showed up, and nothing was there, and we had tried many things, and my doctors were very upset because they said, you know, I should have pushed you to have the MRI 2 years ago. And I said, well, you know, I was enjoying turning 40, and that would have been a bummer. I said, I had a great year. I am happy to have not known 2 years ago that I had cancer. I'm happier now where I can absorb it. It's all perspective. And you know, I don't feel like I have cancer. I feel like I'm healing from an illness. I'm recovering. I'm trying to deal with the deeper things that will help me release whatever created any kind of abnormal cells in my space, my human space of this soul, you know, this energy field. I don't want it to have a disruption anymore. And whatever is creating disruptions in my life, I'm choosing, and I'm making choices to stay away from, or to be more protective of my space and create boundaries. And sometimes that's boundaries in relationships, boundaries in types of foods, boundaries in the kind of communication, and try to really kind of get back to my roots and really kind of absorb what this process has been. That I think is really difficult. Being a patient, though, is quite an eye-opener, and the hospital experience was really difficult. I, you know, hesitantly decided I was going for the larger procedure, which meant I was having not only a radical mastectomy on the right, that was my breast that was affected, with lymph node dissection to see if it had spread. I also had decided to do a prophylactic left simple mastectomy, and not to wait on reconstruction, but to do the reconstruction right away at the same time. And after thorough discussion with surgeons, I had chosen a procedure where I would use my own tissue. I wasn't very comfortable with having foreign bodies in this energy field that we call my body. I was like, how can I have implants or you know, plastic expanders for months and figure out how to heal from that? I don't think I'm going to accept that very well in this body. I would like to use my own tissue. That would be great. It was a longer procedure. It was going to be 10 hours. So that meant they had to find a date, even though I had, within a week, really seen all my doctors, and actually through the recommendation of Stephen had spoken to Jane, which was wonderful. Another blessing for me on this path was being introduced to Jane Goldberg and having such a wonderful conversation on a Sunday, where she really afforded me the time and the luxury of really discussing what was deep in my heart and really hearing it from a place. And you know, doctors don't like going to psychologists, so it was great. I didn't have to go anywhere, but I got a wonderful friend to talk to and to share and to really get to understanding more deeper, and just to be still and hear my spirit. You know, I sit around and witness everybody else's pain, but, you know, being still and being in the hospital, those were the moments where you start to really kind of listen to yourself. I've been a big proponent of meditation. We do a lot of mindfulness practices with patients for anxiety and mood and just restful sleep, and many of these techniques and had helped me to such an extent in the hospital. I mean, how many of us, I don't know if you've had a hospital experience, hopefully not, you can't sleep in the hospital. You know, there is just no such thing. However, my girlfriend put in an Nirvana app on my phone, and I made sure I plug that in every night, and they have a sleep mode called Dormio, which is tremendous. It has wonderful chimes, and I have to say, I decided I was going to sleep in the hospital. I didn't care that they had a routine, and to me, I actually wake up 5:30 prior to having surgery to get my kids out the door for school. So I had decided I'm not going to sleep in the bed and be there in this hospital bed all day. I'm going to try my best to get up in the chair. And yes, you guys come in at 5:30, you wake me up. I remember, I wake up at 5:30 anyway. Okay, I'll sit in a recliner, kind of like this. That's why I'm very used to this. In fact, it's a lot more comfortable than the one that I had in the hospital, which I made sure that the survey was documented, that stuff shouldn't be in the hospital. How can anybody with abdominal surgery be in a chair that doesn't propel? It was very, very uncomfortable. But good sleep is so important, and creating that balance of rest in a hospital. You know, we don't send patients to the hospital to get rest, right? We get them to unfortunately be doused with harmful medicine, and I was on blood thinners. I had all of my IVs and access on my left arm, because as they did remove a few of my lymph nodes, this arm will no longer be able to be used for access or for blood pressures or any kind of monitoring. So I had an amazing surgeon. I really valued, more than the techniques and the education and the background, he had all the skills. Unfortunately, he's out of network. You know how that is, right? But when you know that you've met the right person out of network is more important that you've found the right surgeon. So this is a lot of microsurgery, this process, because they're implanting tissue in other space and creating a flow of blood and energy to that new tissue, which is fantastic. It's a blessing to be able to do that. However, as the surgery unfolded, and I started at 7 a.m., get to the hospital. I don't know why you have to be there 2 hours before, but you do, right? And there you are at 9 a.m., and I said, okay. And my poor husband drove all the way down after dropping off the kids at school, but didn't get there in time to see me before I went into that operating room. My brother-in-law was there. And, everyone was like, you're not kissing him goodbye. I'm like, he's not the husband, but he's here with you. So I did. I felt bad. I was like, you're right. He's a surrogate. I'll take it. I have to say the operating room and the table, it's not foreign to me. I've really assisted in a lot of surgeries, but it's foreign to be on that table. It really is. And boy, I was like, you have to create a theme song in your mind, You have to have a theme song of how you can go into it, because it's a little daunting.
It wasn't rocky, was it?
It wasn't rocky, but I think anesthesia was pretty good during surgery. I can't complain. They do, I think that sometimes preoperatively, I made decisions with some of my other friends who are physicians who are like, 10 hours is going to be a long time, and you're going to have abdominal surgery. I know you don't have high blood pressure, pretty much otherwise healthy, right? She said, you should get an echo, It's a lot of body fluids and, a lot of stuff, and I was anemic. I was quite anemic going into surgery, and the 2 biopsies done by MRI, boy, that was a process. I had no idea. My brother-in-law took me out to dinner right after those biopsies, and I felt good. I drove home. I came home, and I had an ice pack on my chest just for swelling. I was bleeding profusely through that ice pack. I thought the ice pack had thawed out and there was just water, and I went underneath my sweater to remove what I thought was just a soggy ice pack, and my whole bra was full of blood. I had bled out so much. I didn't know breasts could bleed so much. Boy, it wasn't in my concept, and I made sure I told the doctors the next day, but I was really low on blood going into surgery, and I knew I had to boost my energy level especially, and part of my focus became just to get ready, right? And then, of course, I was so vigilant about that as I walked into the OR, but the anesthesiologist, oh, we don't need an echo. I don't even know why you got that. Okay, we'll find out if I needed an echo, but I'm glad I did. Instead of 10 hours, my surgery lasted about 16 hours. Not, for any, it was really because of the experience of how to deal with prior surgery. I had had a C-section 12 years ago with my older son, and it was an emergency C-section. So the areas that he needed to be intact in regards to microcirculation were just lopped off because OBGYNs aren't great surgeons. I'll let you know, they're pretty much butchers. And it's true, It was really unfortunate, but he actually had to repair a lot of things to make this work. And I have to say he was quite meticulous and, steadfast, and told my family at 10 p.m. they were waiting since 7 o'clock thinking I'd be out. And they told them at 10 o'clock, she's fine, but we really need to work on her longer. And they went home, and I was there in the OR till 3 in the morning. And at 3 in the morning, being in the OR since 9, I'm glad I had no break in my anesthesia up in that point. But I have to say, the last thing I remember going into surgery was how the surgical table, with your arms out, you have to kind of be braced out. And I was like, wow, this is kind of, I went to Catholic school, so it looked like the cross, like you had to put yourself on the cross, and they were taping me down. And I said, boy, I don't know if this is good or bad. I was like, it's a good thing I'm really a practicing Buddhist underneath this, right? And maybe this was a cross I had to bear, right? So I, woke up, though, at 3 o'clock in the morning, feeling like myself. I actually didn't have this recovery period because the initial plan was to be in recovery, have some recovery time, take the tube out. I never needed a tube to breathe. It was just for surgery, and hopefully I should have been able to be extubated by the evening. But it was so late in the night. I was 3 in the morning, and I was in a neurosurgical ICU. This was really, a good place. I thought, neurosurgical ICU, they should be keeping tabs on me quite often. Nurses in ICUs are amazing. They usually are. I've worked with many of them. Here I was, though, I was on a vent, and I couldn't talk. I don't know if any of you have tried, but it's not easy.
You couldn't move?
I couldn't move. And as I told you all, my right arm was not being used for anything, but I was tied on both arms. And I noticed when I woke up, I noticed not any pain. I was on fentanyl. I was on a lot of fentanyl, which is actually probably 100 times stronger than morphine. But you can't really take away that experience of feeling like you're choking every minute, because that doesn't do anything for that. It does great things for all the other physical pain. But that respiratory fatigue and that stress on your breathing, which is such an important instrument. And I don't know if I needed my throat chakra cleared or something, but there was an experience that I had that was quite a moment of mental focus. And if any time I needed my mind-body approach, I really, really relied on either my guardian angels, the spirit of my mother. Someone helped me get through that evening, because it was really from 3 in the morning till about 9:30 in the morning till someone extubated me. Despite the fact I actually made numerous attempts to have someone really kind of deal with what was going on, because I really wanted that tube out. And I didn't even have sedation. Like, if you notice that a patient is awake and you're not going to extubate them for many hours, you could easily just give me a Valium or something. I mean, really, come on. What does it take to get a Valium in the hospital? I guess it's really tough at night to do anything.
Yeah.
The other truth is that nurses at night are very lazy. And they are exhausted, but in the ICU there aren't that many beds, so there's no reason to really be exhausted. They have a lot of people working in the ICU setting. And I think the accountability is really important, but this thing about what we said is people don't connect anymore, right, to people. So here you are, you're with me. You're a nurse, you're with me. You're seeing me in pain. You're seeing that obviously I need to be extubated. Well, you know, that's the time you have to either call the attending on call or call an anesthesiologist on call. There are plenty of people in the hospital. And I just think that that accountability was not there. And what was an easier option was tying me tighter, which was really quite offensive to me because I know in a hospital setting that's really quite appalling. And you know, I never had any of those experiences with patients myself, and I really always, huh?
It's torture.
It was torture. It was. The surgical residents, when I had gone into surgery, knew I was a physician. I didn't put it on my chart, and you know, nowadays you don't have to. In fact, none of our names are supposed to be. And you know what? I don't think, honestly, it would make a difference. Unfortunately, I've had people who knew I was a physician in the hospital, and
I'm wondering if it would have
just made it worse.
If it made it worse in this instance, if they knew it, if it did make it worse.
You know, I think it's hard to judge. I think it really isn't, you know, and you know, that was definitely a very important dialogue I had later, because the other part of being awake and lucid and not, you know, not feeling comfortable, but feeling like I was being tortured and being tied down, and having the conversation with the nurse, because I kept showing him that actually my hand was getting numb. So I had to communicate, and I kept moving my head, I kept moving my hands, and he said, yes, you're swollen. And I said, no, I'm not swollen. And I said, I want to write. I need to write because I can't talk. So give me something to write, and I'll write. So I tried my best charades. I think I'll be much better next time I play. But I wrote restraint too tight. It's too tight.
He gave you a pencil?
Huh?
He gave you a pencil?
He gave me something to write. I couldn't even, you know, and this was a very weak arm, but I didn't write dominant. I tried my best to write with a weak arm that was just out of surgery to try to at least communicate that, please release this. Because, you know, even if I'm intubated, my hand has to flow. None of the fluids will go through either. You know, and I think worse than that was being a physician and knowing none of this was supposed to happen.
What was the response
You know.
to you writing the restraint?
He said to me, number one, that he could not release it because I wasn't extubated, and part of that is because they worried that I would pull the tube. And people do when they're agitated, because it is extremely difficult to keep that tube in. All right, so that ship sailed. Obviously, this nurse was not going to do much. He did loosen it a little, and I stayed still, and I did all kinds of meditation and mindfulness work to get out of my head and to get out of that space. But then the next thing I thought of, oh my God, no one's suctioning me. And I'm a physician, and I was like, oh, I'm going to aspirate. I have all these secretions. I've been in the OR all day. I'm sure they suctioned me while I was in surgery, but I have all these secretions. I really need to have someone suction me. So if that was like 3 in the morning when that nurse experience happened, I don't even know, because you know how they're actually supposed to put a clock where you can see it, but I have no idea. But I had a sense of time on my own. I felt like at 5 a.m., some of these surgical residents that did know I was a physician and were in the operating room with me saw me, and they actually connected with me, which is different than just being there and doing your vital signs and getting out. That's kind of what the nurses do sometimes. They barely even connect with the patient anymore, you know? And unfortunately, it was a good thing. Usually surgical residents don't do that either, but I have to say, maybe because I was a fellow colleague, they felt, you know, oh, we understand you're feeling really horrible. And then I again wrote, and I said, listen, I'm probably going to have to write my own orders. So I wrote suction, because prior to that, I had laid my head to one side, kept my mouth open to let all the drool come out, and whatever could drain, because I knew I shouldn't really swallow any of that while I have a tube in. I could really get an aspiration pneumonia or worse, choke, because I was feeling like I was choking on my own secretions at that time, and maybe my lungs weren't as agile yet, because I was fighting with the ventilator because I was trying to breathe on my own. Naturally, our first instinct is to breathe and I think the breathing exercises of meditation and yoga had been such a great benefit to me, whether it be in prenatal work and my experience with labor, but this time it really helped me have that mental focus.
So how many hours were you with the tube that you really didn't need, and you were awake?
I was awake for 6.5 hours from 3 in the morning until 9:30, and at 5 a.m. those surgical residents came and they did suction me. I felt a little relief. Then I think the early morning, probably 6 or so, I think a respiratory tech had came in, didn't really do much examination, looked at the ventilator and realized that I had, I didn't have any secretions, because surprisingly someone came right before you and just did suction. And I'm observing everything, like a physician, unfortunately, and feeling quite, incensed at every step of the way, because, I was like, oh great, somebody's here from respiratory, they're gonna extubate me. I was just in such eager anticipation of when this torture would end. And, I have to have great respect for my surgeon, because he left me at 3 in the morning and showed up at 7 a.m. as he was supposed to, not sending someone else. He came himself, he saw me in the morning, and he's like, oh, she's ready for extubation, 7 a.m. I said, I raised 3 fingers up. I've been ready since 3, but I couldn't talk. So I held up 3 fingers, and he was, quite, interested that I be extubated, and the respiratory techs were with him, and apparently this neurosurgical ICU, where I'm sure there are plenty of vented patients, they have no respiratory coverage at nighttime. It just doesn't seem right to me. But apparently that was the story later on that I would hear. But 7 a.m. when he said that he wanted me extubated, I was still in shock that they waited another hour and a half. And in reality, which really, really created a lot of, at that point you're kind of like, at the 11th hour where you feel like you're at the finish line and you're gonna get this relief that you need. And then you're just like, what? They're not coming to extubate me? What is going on? I really couldn't believe that the respiratory team were doing their rounds. So they would rather finish their rounds than to deal with the patient immediately. So, and what was really shocking was not a respiratory tech came in the room, not an attending came in the room. Actually, the nurse that was assigned to me from the morning, the early morning, she was the one that came in and just pulled the tube out, as easy as that. And I'm like wondering then, if none of them, if they were rounding and none of them had to be there, why did they still wait? There were so many questions, and I think ultimately, it's about not caring. And I think we have to stop this nonsense where people don't listen to a patient, especially a patient that can't talk. So I mean, I went into advocacy mode immediately, and I said, I just was appalled that, I had to have the whole respiratory team there and have some explanations. I'm still waiting for a written explanation from the hospital. And, hopefully I'll receive one, but this should never happen to me or to any patient. It shouldn't just happen because I'm a doctor, but, unfortunately you can't lie to me. I'm a doctor. You don't wean a patient for 6.5 hours overnight. And you do want to make sure a patient is comfortable at all times.
What should have been done when you had the tube in the middle of the night?
I think that it could, there are many scenarios. I think the nurse really was at the accountability stage of being able to perhaps call a doctor, get an order for sedation, at least for a few hours. I was, didn't have to be deep sedation like I received in the OR, but there are many forms of anesthesia you can use. I would have preferred if there was no one that could extubate me, then they could do that. But I think if there was an ability for an anesthesiologist to come in, maybe they would have made a decision overnight to take the tube out. I would have slept better. I would have been at more peace. And then the following morning, this was already early morning, but that same afternoon, I had a very high-grade fever. I had to spend the next day also in ICU, so I had an extended time in an ICU setting where I probably would not have, you know, being someone who also didn't want to spend more than 10 hours of surgery. I ended up spending 16 hours and another 6 hours into
So do you think that incident the night before set you up for the infection the next day?
I do not know, because at the same time, yes, I mean, I do think you're at increased risk for aspiration, and I was in the OR for so long, I definitely had a risk of infection. So it's hard to judge, but I definitely know that inflammation goes up, and of course, you know, it drives inflammation, and any of this kind of stress on the body, excessive stress, and, you know, I think, you know, what we're trying to experience is a holistic setting. I was like, wow, I'm not starting off well here, right? You know, so, but I relied on my integrative approaches throughout my hospital care, even after that, and I was very lucky to have recovered well and then go to a regular floor. And I chose, you know, things that I chose that the hospital didn't necessarily put together for me, but I was able to seek out. The Dubin Center does have Reiki massage therapists, and I found that they would be able to come up to the floor. And I made sure I had at least 3 days where they came up and they massaged me and did Reiki and performed that. I had a friend who was an acupuncturist, and she did come in and do some grounding work with me. My energy was really at a nil, you know. I had to start to recover. And the other thing is, you know, when your body is opened, there's this break of energy as well. So you almost have to heal the energy system from the outside in and from the inside out. So it's not about the sutures only, right? It's all of this. So I actually found that in the end, this being still, listening to my spirit and connecting with myself and choosing to heal and choosing to be out of the experience of being a patient, really not to really be you know, dictated. You know, I needed to find the source of healing that would work for me. And I found that from my mother's experience, that was also something that she chose. And I think ultimately the gift is knowing that we really are at the core of our own healing, that we really have to listen to our hearts first. We have to choose healing that works for us. We have to really think about energy and all of the other elements in our relationships, beyond the things that we do know. And now in the internet and the world that we live in, there's such a resource of data, and it can be confusing, but we have to really think about our intuition and really know ourselves first.
Oops.
I think make a strong case for the need for patient advocate. Even with you being a physician, you were still in a situation where you couldn't advocate for yourself and you needed one. Now, in non-ICU settings, one can often have can have an aide, I guess, can have their own nurse there, other things. Can one, this I don't know the answer. In an ICU setting, can one have like one's own nurse or one's own advocate if they have meet certain credential thresholds?
You know, that was actually our plan of, you know, and that's kind of the supportive system of, you know, just surviving and getting through the healing stage. Was once I was going to be on a regular floor, it was agreeable that someone was going to be with me at night. And even when my mother was in any hospital setting, I was there with her. But in an ICU setting, it depends on what the patient's immediate issue is. If there's a risk of infection, they're going to be a little bit careful about having anybody else stay overnight. And usually in an ICU setting, and this was actually not like a large room. I mean, some medical ICUs or surgical ICUs are much larger. It's really often not allowed that someone stays in an ICU setting, more for the risk to the actual guest, because, you know, there's such a high risk of infection in an ICU setting from the other, you know, being on a vent or having any experience with that and coming right out of a surgical place. We actually limited visitors that day. I mean, there was a ton of people that wanted to come and visit me and offer support, and I was very gracious, but we had like this blanket statement that, you know, I'm at risk for infection, I'm having high-grade fever, please don't come, especially if you're a physician. Nothing, no harm intended, but some of my other friends.
Experience, had you had your own credentialed advocate that would have paid more attention to your
You know,
needs and what you
my-
were asking for, maybe things
You
could
know,
have been
it-
expedited.
It could have, but I really think in this setting, it just wouldn't have happened. And honestly, the delay in the surgery was really a big nexus to this. I mean, really, I was supposed to be extubated before the evening even hit. So it wasn't an anticipated departure, and I was never supposed to be in an ICU. I was hopefully supposed to be on a regular floor, even by out of recovery, maybe one night in ICU and the next morning out to a regular floor. It's hard. It is really hard. I really think, many phases of the hospital experience now, they do use patient navigators, and there are people that are considered cancer navigators. That's something new as well, who help to coordinate all the care for a patient, because it's overwhelming, as many of you know. It's like you have to make all these. I have 3 appointments this week. It's like my dance card's full. And sometimes you do need a lot of assistance if you're weak and, you have a lot of medications you have to take, and there's so many other things you have to process. And in the course of your own healing, you could use a navigator. But they're using the navigators in the more, crisis areas, like the ER, where people are sitting there for hours. Now they're trying to put navigators because they know that's where patients get disgruntled, right?